So I treated him for 5 minutes. I moved his right leg and found the ideal angle where I could push vertically and get motion to translate through the pelvis, and I could see his head bob up and down. And that happened to be about 15 degrees of right hip adduction. And I just leaned on that for 5 minutes. So I don't know if we accomplished anything or not. Let's find out. So his ASISs are much more symmetrical. Underneath them, much more symmetrical. I think the right is slightly lower. Not sure, can't tell by the shelves. A lot more symmetrical. Does it have movement? I can now take up the slack. So that was absent before, and I can now spring it, and it moves forward and bounces back into my hand. Okay? Good. On your stomach, please. Now his PSIS is still higher, distinctly so. That could be developmental, that could be, the whole pelvis again side bending in response to the scoliosis. The top of the iliac shelf is still higher. Okay? We had movement going this way before, so of course we still have movement that way. The sit bone is lower. This was higher towards his ear, but it's no longer towards his ear. This sacrotuberous ligament was tight. I can now indent it. Do that with my other thumb, maybe that gives a better view, but I can now indent that ligament slightly. And the big question is, do we have upward motion? Yep. I can push and take up the slack, and when I spring it, I see his head bob up and down. So theoretically, we move the ilium up in relationship to the sacrum in a person who has developmental asymmetry of his pelvis, or whose pelvis is asymmetrical due to scoliosis. Okay? I'll be curious to see how he feels walking, but especially sitting. So let's have you walk down the hall. Come back and tell us how you feel. So there's my wife up there, Karen, and there's my 4 boys. When they were young, they're now in their mid-30s, with 3 of them have children of their own. Those 2 are twins, identical twins. So how do you feel walking?
I feel like I am putting more evenly distributed weight through.
Oh, speak loudly. You feel like you're putting more evenly distributed weight.
More evenly distributed weight in my left and right leg, as before I was sort of leaning into my left leg. Maybe I guess that's considered
right, because your pelvis was shifted right,
right,
but to compensate, your upper body would go left. So yeah, I'm in agreement.
More balanced. I feel a little bit more centered. I don't feel like I'm swaying to the left.
Nice. Let me watch you walk up and down. Because earlier it looked like your pelvis was shifted to the right. Go ahead. And you know what? Your right arm no longer touches your pelvis. And I think you have more symmetrical arm swing. Nice. Your left foot was toed out a little bit. Mm-hmm. And now it's so subtle, it's less than 5 degrees pointed outward, and before it was like 10 or 15 degrees. Mm. So your posture and your movement did change with that maneuver. Mm. Let's have you come sit in the chair. And sitting is where you were most uncomfortable.
Absolutely.
Yep. But you earn your living sitting down.
Yeah, that's correct.
Yeah. How do you feel?
I feel comfortable, like I'm sitting equally on my sit bones.
Oh, beautiful. I'll take it.
Yeah.
So you feel like you're sitting comfortably equally on both sit bones.
Yeah. As before, I would feel like I would be leaning into the left sit bone to try to get off of the right, yet just creating a whole bunch of pain. But now I feel like I'm sitting.
Wonderful. Yeah. That's fabulous. Bring your feet together, please. I like to look at people in sitting, and I like to look at their thighs and see if one thigh is higher towards the ceiling, making a longer tibia, I don't see that. If it's there, it's subtle. Maybe your left is a little higher. It's really subtle, but not subtle. This femur is longer. Okay? Why is it longer? I don't know. Are your legs developed to different lengths? I don't know. Your iliac shelves look even. They look pretty even in sitting. Pretty subtle. Whatever's happening is subtle. But what I like to do is when I have somebody that presents with one leg being longer, is I take a washcloth and I roll it out and I put it under the trochanter. Let me get that on film. So I rolled up a washcloth and I put it under his right trochanter, long ways. Okay? What does that feel like? Bring your feet together. Good. And now your legs are even. Now your left femur does not look longer. What do you think of that?
Well, the way it feels is more pressure on my left sit bone.
Okay.
So it feels more like the original. It doesn't feel as comfortable.
Is that so?
Yeah, it's strange.
So take it off. Take it out. What I'm going to do now is I'm going to have you sit on this 5mm piece of craft foam, almost a quarter of an inch.
Okay.
Put it under your right sit bone.
Yeah, I mean that now I feel like I'm sitting stably, evenly, and my sit bones are not favoring anything. It feels like there's equal pressure.
Good.
Yeah.
Take it out. And now tell me how you feel.
I feel like I want it back.
Like what?
I feel like
you want
it back.
that thing. You want that thing. Okay, so I'm going to send you out the door with a couple of these. You can buy these at any craft store. Michael's, Hobby Lobby, Joanne Craft. You can buy them online. Some people need the rolled up washcloth. We actually have foam. I don't have one right here now. But we have soft foam that's shaped like a rolled up washcloth that we dip in rubber to make it last a very long time. And we put that under the trochanter in some people. And for other people, then sitting with an ischial lift is more comfortable. And it makes sense based on how we see your pelvis when you're on your stomach, that the right is higher and such. I think your lumbar spine pulls on the pelvis, pulls you over to the left. So anyway, yeah, we'll send you with some of those that you can use. And this is a very interesting case. You know, I could have been fooled and said that's an upslip ilium. That'd be really easy to do by the posture evaluation, the alignment evaluation. But we had to look at it from a perspective of how does it move. That's when you diagnose these different movement dysfunctions and look at ligament tension and then also know what's not changeable. You know, and the pelvis developed asymmetrically, so then when you go to sit, the chair tries to force you into symmetry, and that causes some discomfort. So if you can, you know, lift up the pelvis to its own natural shape, then sitting is more comfortable. So a really informative case study to show the difference between how something looks and how it moves. This downslip should stay corrected. I have other videos that show self-treatment for downslip, so I'm not going to show that right now. I'm not going to show you it today because I want you to go, you know, walk and sit and, you know, go sleep and turn in bed and all that stuff and put those forces through your pelvis and through your hip and SI and come back tomorrow. And then I want to see how it behaves. And maybe it'll be a permutation. It might behave a little bit differently than today. I would predict you're going to come back and it will still be corrected. And I would predict that you don't have to self-treat it, but you will know how to self-treat it. That's what we do.
Excellent.
So, good. Well, let's stop here, and I'll then look at the rest of your body. I'll screen your neck. Thank you.